Namaskar, good afternoon, warm welcome. Thank you for joining us for this very important discussion on Atypical Hemolytic Uremic Syndrome or aHUS, a disease that is rare but life changing. Today, our aim is to go beyond statistic to understand personal journey, diagnostic hurdles, and the way ahead for the patient care in India. I also welcome today Miss Deepika Jaiswal, a mother, a caregiver to a pediatric patient. Warm welcome to you.
Thank you so much.
We also welcome Mr. Saurabh Singh, Rare Disease Patient Advocate, co-founder and director, Rare Disease India Foundation. Warm welcome to you, sir.
Thank you so much.
Continuing with our discussion, I would now like to request Mr. Saurabh Singh to throw some light on this particular question. Mr. Singh, from your work at the Rare Disease India Foundation, how common are such diagnostic delays or confusion for rare disease families? And what resource exists to help these families essentially during those very critical initial days?
Well, this is very good question. In rare disease, we have seen so many times there are diagnostic delays. This happens every time with all the rare diseases, including aHUS. What happens when the patient goes to the doctor first? The doctor is confused aHUS with some other kidney disease, and also with other rare diseases also, because the symptoms appears late. And once the symptom appears late, the delay in diagnosis and so on, the treatment also starts very late. So there are confusion in this. So the delay is possible due to some reasons. And yes, there are so many challenges also. And Rare Disease India Foundation is a patient advocacy organization which is organized, which is formulated by the patients, by the parents of the families, and all the patients who are there in this organization are the volunteers, and the parents are also the volunteers in Rare Diseases India Foundation, and they work for this community very hard to raise awareness, to sensitize the general public, to the government, to the media, everywhere. So this is a very good work by Rare Disease India Foundation. We help those patients who are very needy. The support is very much required for those parents who don't know what is the rare diseases, where to go, to whom to approach, how to get the government support for these rare diseases. Yes.
Thank you so much for that insight. Uh, Now, coming to the discovery and the diagnosis part of it, Mrs. Jaiswal, I like to ask you that, as a mother, could you just share how your son's symptoms first appeared and what diagnostic journey was like for your family? Were there any signs, any delays that made you worry that it might be something very rare?
Yeah, hi. First of all, I would like to introduce my son about AHUS. Adyan got diagnosed with AHUS when he was 11 months old. He was an infant. Earlier, he was a very playful child, and he's reached his milestones very early. He was gaining weight, he was eating well. So there was no symptoms at all. It was a family function which I needed to attend in Raipur, Chhattisgarh. That is my hometown. And that night he was restless and he was little febrile. So I thought that might be travel can be the case. That's why he's little restless. But next morning, I took him to a local pediatric doctor where after seeing him, he said he's looking pale and he ran some blood tests that time and he misdiagnosed us with thalassemia because his HB was very low. So, being a parent, it was we thought to take a second opinion from another doctor. So, luckily, he was a pediatric nephrologist, and he also ran some tests, and he diagnosed him with AHUS, and he referred us to take him to Delhi AIMS immediately.
Right. Thank you so much for sharing your experiences. But just taking it a little forward, Mrs. Jaiswal, um, did you experience, like you just mentioned, that you were in Raipur and you luckily found somebody. But apart from that, did you kind of find any difficulty in terms of its treatment? Essentially, if we talk about the cost part of it, how cost friendly was it? And did you have to regularly travel out of your hometown or somewhere else to get the treatment?
Because that time I was traveling for a family function, and the doctor there itself, he told me that he needs dialysis immediately. So basically, he was an infant, so he said that peritoneal dialysis we can do there in Raipur itself. But we were not keen of getting dialysis done in a hospital in Raipur. So we traveled to Kolkata that time, and with another doctor. She is also a pediatric nephrologist in Calcutta. So there, his treatment started with dialysis and with FFP infusions, that we say FFP transfusions, and my son recovered that time.
Okay. So, would you like to throw a little more light about was it like cost effective? Did it, I mean, something to do with the treatment and its accessibility?
We didn't have any options that time. Dialysis has to be done, FFP transfusions has to be done. She told initially AHUS patients need lots of FFP plasma exchanges, but we were not keen of getting that to be done with our son because he was just very small, and we were very skeptical about things, that what AHUS exactly is. We were getting some knowledge from the doctors, talking with different doctors regarding the same. So initially, after seeing us, because we were very skeptical, we didn't want to get a plasma exchange. So she only told us that only okay, we can go for with plasma infusions that time.
Okay, now coming to you, Mr. Singh, and I'm talking from a very patient advocate perspective. From a policy standpoint, what kind of support does the National Rare Disease Policy provide to families suffering from the rare disease, including AHUS?
First of all, I'm very thankful to the Ministry of Health who have made this National Rare Disease Policy very recently after amendment into 2021. So this National Rare Disease Policy says there are some diseases in that policy in which AHUS is also among them. So in that National Rare Disease Policy, there are so many diseases in which patients can get the funding from the government to the center of excellence, and patient can get the treatment in the respective COEs, I mean center of excellence. Under the National Rare Disease Policy, ministry has identified few centers where the patients can get the treatment free of cost under the National Rare Disease Policy. And these center of excellence are in different states also, and increasing day by day by the Ministry of Health. So patient has to approach to the center of excellence for their treatment, and then they will get the funding. And there are capping of 50 lakhs rupees in National Rare Disease Policy. But some rare disease have the treatment under 50 lakhs rupees, but some are not. So in that case, patients are struggling still. This is the challenge in National Rare Disease Policy.
Right. But for families who really wish to, like, taking this conversation forward, who wish to enroll themselves with the NPRDs, and is there any process? And I would also request you to let us know if there is a process. What are the critical steps, and who are the key authorities? And just to add on to a question, how long on average does it take from an application to the approval?
First of all, once the patient is diagnosed with a rare disease, the patient has to move to the center of excellence first, to his respective doctors, means the doctor who are there in the center of excellence, the expert one. Then the doctor will recommend, after his application for getting the treatment under National Rare Disease Policy, doctor will recommend Ministry of Health for the treatment of these patients. And after the approval of center of excellence, the funding is given to the center of excellence for the particular patient for the treatment. Then the fund will come. Or nowadays the new changes has come, already the center of excellence have the fund, and center of excellence, after approval from ministry, they start the treatment of the patients of any rare diseases. So this is one. And every patient has to go every time to the doctor and ask about the further process, what happens, because it takes some time for getting the approval from the concerned person. So it generally takes 2-3 months actually.
Okay, thank you for that information. Now, Mrs. Jaiswal, I'd like to ask you that how is it to live with a AHUS affected? How is it to live in an AHUS affected family? How does the daily life, including school, social gatherings, I mean, relationships, work, let's talk about the emotional well being, that sort of gets, how does it get affected? And what has helped you the most in this difficult journey?
Adyan, my son, he is a super strong headed boy. Daily, on daily basis, we learn from him. Actually, as a
Right.
parent, we learn from him how to live courageously with this disease. He is a super strong headed boy. I have not seen any kid of his age with so much strength in him himself. So basically, it's our own choice. We have not sent him school. He's basically doing a homeschooling,
Right.
and because he was diagnosed with in a very early age, so his school authority in school, they know about that disease, what's going with him. So they have allowed him to appear for exams. So he used to just appear in exams, and we don't send him daily for his schools because he used to get infections oftenly, and every infection led him to a relapse, AHS relapse. And right now he's in dialysis thrice a week from last 1.5 years. So life is just like that, difficult sometimes, easy if we think being positive. And we look up to our son.
Right.
He's super strong headed boy, I told you.
Mm.
So life is going on. We are waiting for his transplant. He is listed on Caregiver from
Mm.
last 2 years. We are just waiting for his transplant to be done.
Mr. Singh, based on your past experience, what are the key challenges that families face if it is a rare disease? How is your foundation working to address these gaps and support these families? Are there any support resources that would that you would recommend to the AHUS patients and their families?
Yeah, actually, once the patient is diagnosed with one rare diseases, that is a very critical time for those parents and the families, because that time they started feeling isolated. They are in something in trauma. It happens with me also because I am also a parent of a rare disease child. So I have personally experienced it. You don't will have to speak in, and your family member will understand, but your other relatives will not understand what is happening. Your society will not accept actually. Your challenges are very different from others. So this is the time when the rare disease family needs assistance by some care, some support system, like our foundation, Rare Disease India Foundation, or any organization where the similar kind of patients are there. They can talk to each other, they can share their experience, their emotions. From there they start generating their willpower. And yes, you have to every time go to your doctor and speak loudly. Don't hide it with the society and with your family members that my son or daughter is suffering from rare disease. You have to speak, because if we will not speak, will not ask, will not demand for our treatment, we'll never get any treatment. We have not got this freedom in free. We had to pay. So still the national rare disease policy has come. How? Because of our efforts, combined efforts with the parents, with the families, with the society also, and with the honorable courts in India. Many parents move to the High Court and Supreme Court also, And then the National Rare Disease Policy came into existence, and now we have the funding mechanism under National Rare Disease Policy 2021 after amendment. So, still there are so many gaps and which we have to fulfill. Not alone we can do. We together we can, because due to raise the awareness about rare diseases, just sensitizing general public, because they don't know, they are all, everybody is busy in their own world, they also have so many challenges. We have to tell them, yes, we are very different from others. The child who take birth normal, other child does not play with rare disease patients because of their gesture, because of their xyz reasons. So why? Because they are also a human being, we should be treated equally. We have the right to life under article 21 in Constitution of India. Why will not we can get our treatment? We are also the taxpayer, so we can demand. Now I am very happy that government has understood all these challenges, and they have brought us for National Rare Disease Policy. And yes, there are challenges of 50 lakhs capping, but I am very hopeful that this capping will be removed very soon by their efforts or by their combined efforts, because National Rare Disease policy, we have also given so many recommendations to the ministry. We organize so many awareness campaigns for rare disease patients. We organize Walk for Rare every year in the month of February. This year also we have done this activity in different states by calling all the stakeholders, including including the patients, the families, the doctors, the ministries, the general public, the media. So many people walked for this special cause just to raise awareness about that. So we together one day will definitely come, will when all the rare disease patients will get the treatment without any issues. Now government is also working very hard with us.
Thank you for that very positive note. And maybe I like to take the point forward when you mentioned about the 50 lakh cap. So, according to the NPRD policy, which you mentioned, provides a financial 50 lakh cap per patient for the rare disease support. Are there any funding mechanisms or resource if additional support is needed? Are there any? And also, to further to that question, what are the systematic changes do you think you should, as someone who has been part of the understanding of this rare disease, what do you think is systematic changes that you need to have to prevent these families from, like I can say, that falling into the cracks? What are these little policies which needs to be enhanced or changed, and are there any mechanisms like that?
Beyond that, there is no any mechanism, but still, due to some small funds for the states we have, patients can just give their applications to the chief minister. The chief minister also have their funds for supporting these type of causes.
Okay.
They can, if I'll take the example of Rajasthan government has done very wonderful job. They have started 50 lakhs additional funds for rare disease patients. They started a crowdfunding portal for their own states. They also started giving 5,000 per month caregiver support to the families. So these kind of supports are always there, that everybody has to understand. If any patient wants to get more support, they can write to the Prime Minister and they will get the Prime Minister Relief Fund, that is around 3 lakhs rupees, I believe. They can get from the President also. There are 1 or 2 lakhs rupees support from the President. You can manage this disease for some times. This is the fund actually available with us, apart from the National Rare Disease Policies Fund.
Okay, thank you so much for that information. But I will ask you a little more about what you think, since we're talking about policy making and policymakers. I want to know your opinion that how can government, pharma companies, and public health providers work better? I mean, essentially together to strengthen the rare disease ecosystem.
Yes, definitely. We all together, we can build this ecosystem. and including the ministry, the government has to identify those leaders of from these organizations, the families, the pharma companies, personals who can support this cause, or through under CSR provisions. We both can sit together and understand and plan how we can go ahead. Because if you'll see the national rare disease policy, there are provision. The national crowdfunding portal is launched by Ministry of Health. Together we can sit and plan how we can go ahead and how we'll get the funding, how the patient can be supported, because these patients are also the citizen of India, and government has to think about that.
Right, very aptly put. Thank you. Coming to you, Mrs. Jaiswal. What is it that one message that you would like to give to the newly diagnosed aHUS family based on your own experience and your journey?
Based on our experience, I would like to suggest to the families that please do whatever the doctor is suggesting you to do. Get the child blood test every 10 days, what we used to do. Every 10 days, we used to get his blood labs reports done. That is the main markers of aHUS activity, that is creatinine, platelets, HB, and LDH. Get it done every 10 days. And please do whatever your doctors are suggesting. And most important, please love your child a little extra. He needs that, because this disease affects the child psychologically.
Now, as we're proceeding to the concluding part, as much we've discussed and heard, I wanted to ask you all a question, that what is it that one message that you'd like to give to the policymakers, and also what should be their topmost priority? If you could say, throw some light on that.
Yes, wonderful. Actually, I believe the cost must be affordable for all the parents, so that parents can afford this treatment, because the treatment is very expensive. The cost is very high. The government must think over it, and either all the cost should be borne by the government, or the cost must be reduced, so that everybody can afford it. Because in India, uh, neither insurance company covers this costs, and also no parent can afford it. So government should remove this capping of 50 lakhs rupees, or this cost must be reduced.
Coming to you, Mrs. Jaiswal, what is that one message that you like to send it to the policymakers, and what should be their top priority?
Same that Mr. Singh has just said, that the cost should definitely be affordable for every parent, because this treatment is very expensive, and the insurance should be covered. There should not be any cap. 50 lakhs cap should be removed. And definitely the medicines, the drug which is needed in aHUS, that should be very cost effective for every parent.
Right. Thank you so much. Thank you once
Thank
again.
you.
Thank you.
Well, thank you. Thank you all for sharing your expertise and your candor. We hope this discussion will inspire new solutions and collaborations across the rare disease landscape. Thank you all for being part of this very urgent conversation. Thank you.